So let's look at the symptoms of BPD, borderline personality disorder. I'm going to read to you from the DSM, the Diagnostic and Statistical Manual for Mental Health Providers, which is what we call our clinical Bible that helps us diagnose when we interview someone so that we can build a treatment plan to help them. So I'm going to read the exact criteria just so you know the verbiage as it's clinically and formally, technically described in the DSM. And then I'll add in a little bit, maybe I'll do another video about like symptoms in terms of how this looks in real life. So here we go. Borderline personality disorder. So first, it's a pervasive pattern of instability of interpersonal relationships, self-image, and feelings, and marked impulsivity beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following 9. Number 1, frantic efforts to avoid real or imagined abandonment. So that fear of abandonment that makes you do things to try to keep people around. Number 2, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. It's a defense mechanism known as splitting. So you think someone is the greatest thing since pockets on shirts, and then you think they're Lucifer in human form. Now, the examples I'm giving are a little bit hyperbolic to make a point, so you may fall somewhere on a continuum, okay? So don't misunderstand and don't come at me. I'm just giving examples to make the point. Number 3, identity disturbance. Markedly and persistently unstable self-image or sense of self. So no real sense of who you are or what you want for your life or what your future looks like, those kinds of self-image issues. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. So examples would be spending, sex, substance abuse, reckless driving, maybe even binge eating. So we're looking at impulsive behavior. Number 5, recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. So recurrent suicidal behavior or self-injury. So it might be burning, cutting, biting, pinching, hitting yourself in some way. Those would be forms of self-mutilation or self-injury. Number 6, affective instability due to a marked reactivity of mood. So intense episodic dysphoria, irritability, or anxiety that usually lasts a few hours and only rarely more than a few days. Number 7, chronic feelings of emptiness. Number 8, inappropriate, intense anger or difficulty controlling anger. Examples would be frequent displays of temper, constant anger, recurrent physical fights. So easily provoked to intensity, and anger in particular. And number 9, transient stress-related paranoid ideation or severe dissociative symptoms. So in BPD, we might see some paranoia, we might see some dissociation, or we might not. And it's fleeting. It comes and goes, potentially. And the idea is that it's going to come when you're more stressed, just like a lot of symptoms, actually, physical and psychological. So those are the 9 criteria. And if you hit 5 of them, you are inclined to get the diagnosis. And then we build a treatment plan around working through trauma, if there is any, doing DBT, doing a deep dive into family of origin, and reprogramming your thoughts if needed. Those kinds of things. So there is help available. Do not give up. Again, those are the criteria just straight out of the DSM. And I will do another video talking about maybe some examples of what these would look like and going a little more in depth. Thanks for watching.